Welcome to the CADIO webinar series. Today we are so excited to be joined by members of the Illinois Critical Consciousness Collaborative. We have multiple people contributing to the webinar today, so I'm going to begin by introducing everybody and then I'll hand it over. Lily is a professor of social work and associate dean for research at University of Illinois Champaign-Urbana. She is the founder and chair of the Critical Consciousness Collaborative, and her research seeks to develop and test multi-level interventions to promote health equity in the fields of substance use disorder treatment, infectious disease prevention, and the criminal legal system. Carla is the assistant project director at Comprehensive, where she ensures grant compliance regarding the standards set by government, which include program rules and requirements, documentation of program processes, progress, impact, and reporting of data. Kenya and Andrea are COVID-19 outreach workers, peer navigators, and intervention group facilitators at Comprehensive, located in East St. Louis. They are both pursuing college education in the field of health. So welcome to all of you. Thank you so much for your time today. We're so happy to have you, and I'll hand it over.
Thank you very much for the invitation. It's very exciting to be in dialogue with you guys. And I'm thinking about keeping this very informal. So if you have questions along the way, just feel free to jump in and ask. So I thought I would start with this slide in terms of what we mean by community-based participatory research, which is essentially, I always think about CBPR, let's say community engaged research is a continuum. It's an umbrella term. And I think about research as going in this continuum all the way from very traditional research on one end to CBPR at the end of that continuum in being the most participatory, reciprocal kind of approach to research. So what you get is this column here in the right, where the engagement in the initiation of the research is reciprocal. It comes up from both the academic partners and the community partners. And I think that that's a very important word when it comes to CBPR. It's the word reciprocal. I have seen kind of like both ways, where sometimes a team will put so much emphasis on community partners that the reciprocal gets lost, while the researcher gets so much emphasis that the community gets lost. It needs to be a reciprocal, equal partnership. The study aims are defined collaboratively. The research and design, including sampling decisions, are all made jointly. Measurement and outcomes are defined jointly. Procedures, you share responsibility, and both all types of partners in those activities, as well as the implementation. Evaluation is a huge part of CBPR, especially the process evaluation, in order to ensure that the main principles are being implemented the way that they need to be, so that you can also adjust. And the evaluation piece is really important in terms of the communication, power sharing, making sure that everybody's on the same page, making sure that the training that needs to take place is taking place, and so forth. And then, of course, there's joint work in dissemination, and also when it's time to stop a project or start a project. Some groups will actually have project-based engagement, in the sense that community partners and researchers will come together and work together around a specific project. Other styles can be a group of partners and researchers, community partners and researchers come together to talk about community projects, and they work together to kind of identify what they want to work on. But the idea is that it's reciprocal if you're doing CBPR all the way through. So when you put CBPR and MOST together, the idea is that you're merging two principles, two frameworks together, and they are being implemented together in every single step of the process. In the example of the 3C, this has been done over the course of about 14 years now. And in kind of like every step of the way, we are talking about both CBPR and MOST, getting trained on what the frameworks are, and identifying projects at any given time that make sense for us to do based on what we are trying to accomplish. And one thing that I think is really, really helpful in merging CBPR and MOST is that the partners become key people in helping identify the components, the constraints of collecting, analyzing, interpreting the data, and making the decisions about the final intervention bundle. And you should be creative in terms of the methodology that you're going to choose, keeping in mind that both MOST and CBPR are frameworks. So they're giving you guiding principles.
Did we lose Lily?
Yeah, we have her slides. So, Mia, would it be possible for you to share them?
Yes.
Well, I think the plan was that Carla, you would speak a little bit next, right? What, shall we just ease right into the next portion of things? Maybe you can give us a sense of where in the slides. Is this about the right spot?
So what we wanted to do is share a little bit about the experience that we here at Comprehensive Behavioral Health Center experienced with the collaboration with Dr. Windsor. One of the questions Dr. Windsor posed is what motivated the center to partner with her? East St. Louis, Illinois stands as a prime example of the intersection between environmental injustice and systematic racism, particularly during the 1990s. This predominantly African American city, already struggling with economic struggles, faced disproportionate environmental hazards that perpetuated a cycle of poverty and health disparities. Comprehensive joined the project because of Dr. Windsor's passion in promoting health equity in underserved communities and what positive impact that could have, and also in our learning journey in health equity and the positive relationships we could build within our community. The next question Dr. Windsor posed, what was it like for you to learn about MOST and CBPR? The COVID-19 project and the community-wise projects that we partnered with Dr. Windsor on introduced us to community-based participatory research, which is a CBPR, a collaborative approach to research that involves engaging community members, researchers, and organizational representatives as equal partners to enhance understanding of a given problem, create change, and ideally improve the health challenges. We learned that effective community-led resolutions to challenges should include approaches that give space for communities to identify problems, explore solutions, and draw up action plans to address the community needs. Traditionally, research methods did not commonly reflect community voices and perspectives. The COVID-19 study invited community members to be meaningfully engaged in the research project. The study treated community members as equal partners in the study, which helped us forge meaningful relationships between the study researchers and the community. Using the multi-phase optimization strategy, otherwise known as MOST, approach in the study helped us to understand which intervention components worked and which did not, and improve the interventions programmatically over time. The comprehensive team would meet weekly with the research team to discuss research approaches and methods. And then the entire research team does meet in person once a year. Dr. Windsor wanted to know what problems did we encounter and what lessons did we learn? Setting up the contract with the University of Illinois so that we could receive reimbursements in a timely basis was rather challenging. There's a lot of hoops that you have to go through, but we all remained vigilant in getting that accomplished. Building trust was critical as the project started at the agency before the contract was in place, but Comprehensive had that trust in Dr. Windsor that everything would come through. Hiring and training staff was a challenge in this community due to the shortage of people in the workforce, finding people with the right attitude, connection to the community, and the ability to implement the project. Onboarding the staff in the university system was also challenging. We had to complete HIPAA and IRB training, gain access to REDCap, and learn the system. Keep our accounts active so that we would not lose access to the database. Another challenge was figuring out the best approach to collect data. Dr. Windsor wanted to separate the research for the delivery of the interventions, so she had research assistants from University of Illinois collecting data. We quickly learned that it was much better to hire a different staff person at the agency to collect the data because our staff have the relationships with the community and we're a lot more effective finding them and recruiting them. Gaining the trust of residents in the community did take some time. This community historically has a huge mistrust with not only different governmental agencies, but in service providers as a whole. We learned we really had to listen to the struggles and challenges our community was experiencing so we could properly respond. Also, what became a challenge was holding groups with a variety of personalities and opinions from the members from the community who participated in our studies. Another question was, how did you build the 3C board and what does the composition of the board look like? We originally thought about the board.
Hey,
Yes.
Carla, I'm sorry to interrupt you, but I think that if Lily were here, she was hoping that this could be a little conversation-y. And so I'm wondering if it would be okay with you if I tried to have a little conversation with you about some of the things you said.
Absolutely, please.
Awesome. Okay, so I think that we have a deeply stacked participant list in our webinar today who are engaging with a board and folks like you just talked about. And one of the things that they're starting with is where to even start to describe most. And so I wonder if you could very plainly say how much detail, what was the best way that it was presented to you, or what do you wish you could have known?
Well, I have to say, Dr. Windsor and her team were so informational and in their approach to us with their research models, and they were explained in great detail what their research intentions were, how they intended to get the data, utilize the data, and the outcomes that they were hoping to achieve, and the different processes that they would bring to the table to use, which included most in CBPR. Because, when they initially approached us with these projects, we had no experience or familiarity with most or CBPR. But Dr. Windsor and her team presented it at such a level that all of us could understand and appreciate.
I think the point you're making is one that maybe I, in particular, have not really thought too much about, and how it's really these two different frameworks and philosophies that you need to be exposed to. Just because you are a community member doesn't mean you know what CBPR means.
Absolutely.
Right? Yeah, that's
absolutely. It was so important to really learn that at the initial start of the project so we could understand how everything is tied together and how to properly move forward.
Awesome. And before I somewhat, I hope, smoothly and politely interrupted you.
That's okay.
You started to talk about the kind of composition or maybe organization of the board. and in particular, some personalities to balance. And so I wonder if you might want to share some of your thoughts there.
Yeah, so initially, we thought about the board as a traditional agency board. So we initially approached the influential people within this community for membership. That was useful in educating Dr. Windsor and her team about the history of this community and the key players. We did also hold a 2-day retreat with Dr. Windsor's team, as well as the individuals we approached for membership with the board. So we could take some time to really learn about each other. After the retreat, we understood that the collaborative board is different from a typical board. So we changed some of the membership to include people that had boots on the ground in this community and had some lived experience. So we do strive to keep the membership of the board at least 50% of people with lived experience from the community.
And is that so how are you going about to invite those with lived experience to join the board when you need to re-staff or re-seat that?
Well, the approach that we took here at Comprehensive is because of the two projects brought so many people from the community into our environment. And over time, with those studies, we got to learn the individuals, hear about some of the challenges and passions that they have. And so what we do is we reach out to those individuals. Those are the people with the lived experience. We've already learned a little bit about them. They've already learned a little bit about us. They have full confidence in Dr. Windsor and her team already. So it's been beneficial in that regard, that really we haven't had a lot of challenges filling board member slots.
I mean, I think that's pretty lucky and wonderful. It sounds to me, what I'm reflecting on hearing in hearing you talk is about the time and the importance of investing in building relationships and trust. And
Absolutely.
I think it's nice to hear your take on that too. Awesome. I will just verbally say if there are people on this who have a question or want to join me in conversation with Carla, please feel free to do so. Carla, anything else on here before we maybe invite your colleagues to speak also?
Yeah, I mean, I want to just expand a little bit on how do we build the 3C board. What we did, we respectfully listened and acknowledged to issues that community members brought to us so we could effectively partnership with them in the community. Our staff went out to the community, within the community, to explore what the knowledge and challenges were of the community, incorporating community voices that could help frame research in the most inclusive way. So, I mean, we really went hands-on and met the people in the community at their level, hoping to gain their trust. And I think bringing that back is what made the two studies so successful here at Comprehensive.
I'm just envious. That's wonderful.
It's really been a wonderful experience, not only for our staff, but for the people in the community, learning about these research approaches and the impacts that the outcome of the data can have on a community. It's so important. A lot of people, I don't think, understand or even realize those impacts, but it's been so beneficial for this community.
I love that. It feels like it might be a nice segue, and then potentially at the end there's a time for all of us to chat together. Thank you, and thank you, Carla, for rolling with it, and jumping in. We'll keep going unless we've heard differently from Lily. Okay. So I think Kenya and Andrea, I think you're.
Yeah, I'll go first. I'm Andrea.
Okay.
Hi, everyone. So I guess I could just start with my involvement in the 3C, and my experience. When I was invited to the board, I was currently working on the COVID-19 study, in which we were administering COVID tests. Was my first experience getting out into the community. We started to go to all of like the local places, hotspots. We went to Metrolinks. We offered them lunches. We just like was giving them little toiletries. That's how we got in a community. Like we met them in a community. So when I was invited to the board, it was just interesting to see like what other things they could help me learn to help my community. That was why I said yes to it. The retreats that Lily had for us, I've been part of the board for 2 years now. I've been on a total of 2 retreats. It gives us the opportunity to meet other board members, like in other parts of the world, because there's another board connected to us in New Jersey as well, outside of the East St. Louis board. And then she creates these email chains, so we are always in contact with each other. We can always communicate with each other, even though everyone is in different states. We also have like a bunch of ongoing meetings just to touch base, and she let us know whenever she have like new studies coming our way or new approaches. And they also help with like our relationships and allow us to build support, because when Lily offers us something, like even when it came to the money situation and the funds at one point, she always tries her best to like come through and do exactly what she says. So it develops trust. I guess that's where the trust part comes from.
Is there another example? So money, right? Like yes. Is there another type of tangible product, effect, something that helps you to recognize the trust from Lily?
Yeah, she actually she's met us like one-on-one, like she travels for us like Lily. She stays where Michigan, New York City, New Jersey. She be a couple of places, but one thing about her, if she set up a time in a meeting for us, it doesn't matter when it is, she always comes. So we was able to not only talk to her via Zoom and talk to her on the phone when we needed her, she comes like in the building. She meets with us, she meets with other people in the building, and she also like doing a couple of our groups when we hosted graduation, she met with the people from this community. So everything, she's real good with the one-on-one.
I think that's a great example. Thank you for that. What would be the best thing to do? Do you want to pop to Kenya to do her introduction, or
Okay.
it's up to you. Do you want to keep answering? I'm sorry, we're rolling with the punches here.
And Lily's back.
Oh, great. Lily.
Apologies, guys. I don't know what happened and how long it's been since I've been gone.
But your team was on top of it, and Kate's been on top of it. Carla and Kate had a great discussion about some things. We were just getting into the final portions with Andrea and Kenya. So you can tell us how you want to proceed. I'm assuming we just jump back into your portion.
I will let them finish doing their thing then. So we'll kind of flip. They'll do their portion first,
Sure.
and I'll do my portion next.
All righty. Well, my name is Kenya. I also started with Lily back in 2010. 22 when we first started the COVID-19 project. Most and the CBPR have been very interesting to learn, especially coming from being a community member and learning how to navigate when having certain conversations. We talked about problems that we encountered, and we talked a lot about money and things of that nature. But also we talk about the problems that we encounter with sometimes having these groups with these people inside of our community. Even though East St. Louis is a predominantly Black community, there is a melting pot of individuals that come down here in this area. Some can be for good things, some can be for bad things. But we have a plethora of people down here, and working with these individuals to also see how the community-based participation can work could be a challenge. So at some points, some individuals have different ideas on how a community should work, or what's the problem inside of the community. But being able to lay everything down and let them see all the different issues that they feel are a problem within their own community, and figuring out ways to address it was really good. Even when it got, down to arguing, and sometimes inside of groups, the gentlemen always would kind of calm themselves down and kind of reflect on the situations that we are talking about, because they can be controversial at times. You have any questions before I keep going?
I think you're doing great. I just put in the chats, the other folks, if you have questions, feel free to drop them. I think the question that's in there right now would be great to return to at the end. So Kenny, if you want to keep going, you got it.
For the most part, to get clients in, money is a really big thing down here, being the fact that even little resources to buy hygiene and things of that nature are very slim out here. So being the fact that Lily was willing to offer cash, and even at one point offer more cash to get more people to come through the door, was an even bigger thing, you know what I mean? We started, especially with the COVID-19, when doing some of our small groups, we started with little to no one wanting to come to those. What experiences were most important for building the trust between between research and community groups? Being there, giving them those resources that we were able to find, and those resources actually falling through, with the things that they say that they have. Those were really big on getting the trust that we have with a lot of our people.
Also, to add on to that, when it did come to like building trust with the people from our community and like bridging the gap between that and research, money is always the issue. Like Lily did have to up the pay like a couple of times, but as far as the relationship part goes, we have people that still come down here right now today like, hey, do you guys have any studies or surveys we could do? Because what they got out of it, like it started with the COVID survey, but then by the time we made it to community wise, we went from paying people to come to groups, like begging them, to actually people like, okay, when is the next group? Can I sign up for the next one? To the point that like that helped us to get our drop-in center. And a lot of the questions that they asked when they was doing like, the COVID study, or when we did community-wise, a lot of the issues we was actually able to help them even with small things like toiletries, or they would get a bus ticket if they was able to, a ride up here, then they will be compensated. So then also when they come in here, we provide them with a lunch. So that helps like bridge the gap, because even though they're coming here, they know that the stuff that they share with us is confidential and private. Like we don't tell anyone what's happening between them. And then also, you know, they can come and then like they can eat and relax, and we're able to offer them the resources to the point they like, when is the next study? When is the next? It works.
I think that's I think these are really wonderful kind of things to reflect on. And Lily says a lot about this collective that you've put together, where it's not transactional and it's very much about the relationship. And I'm wondering if, Lily, is there something you would like to go back to in the presentation just before we spend too much time going into these very rich questions in the chat? Or what would you like to do?
Let's go back a few slides.
Okay.
And, I think many of these questions were already answered when I was talking about these slides. No, forward one more. Let's just focus on this one, because this is where I would spend the most amount of time. And I will talk more about really focusing on the work with the relationship. So this slide here, it kind of like summarizes the entire process of my journey, implementing initially CBPR. And then when I discovered MOST, and I was so excited about it, I started blending those two things together and figuring out how to do it. So I'm going to start like describing briefly the preparation phase of the study, but in the context of a few things that, if you're doing CBPR, are absolutely critical. First one, you need to, of course, get a community partner, right? Not, or maybe a few. In my case, and in my studies, I wanted to find a partner for the long haul. It's not just coming in, I have this study, you come help me in this study, and then we're done in our partnership. No. It was more like, this is a community I really care about. In my case, marginalized communities that have a large proportion of Black residents. And I really wanted to come and work with those communities to build capacity, to find resources, to try to address challenges, especially racism and structural barriers, right? Because these communities are so disinvested. So part of the idea is, how can we bring resources, but also raise capacity to be advocating for the needs of the community and working with governments and all of that. So initially, it was about finding the right partners. And I think that one challenge that you guys have seen a lot, I think in your own experience with some of the boards you've been working on, is that these boards have not spent the time that is needed and gone through the trust building project. I always say that you have to move at the speed of trust, not at the speed of your grant. And I know that that can be very, very difficult to do. And this is why I think that being in this for the long haul is really critical, because once you put in the time and effort to build that trust, it's there for you forever, as long as you continue being consistent. As Andrea said, follow through is absolutely critical. And not just follow through, you have to be there. One of my community partners, for example, told me one time, you were the first PI I've ever met that was willing to come down to NJCRI and do street outreach, walking with us, and approach the community and talk to the community and hang out with us. And I spend a great deal of time getting to know my partners. So we kind of initially 14 years ago, when I first started in Newark, it was a Newark Community Collaborative Board. And we were meeting weekly, and for 2 hours every week, I was paying them for the time because it's the right thing to do, trying to be transparent with the decision making. And I didn't have a particular agenda. The agenda was, this is a community that needs help, that needs research. It's a community that's been neglected. There was a lot happening in New York, almost nothing happening in Newark at that time. What can we do? And I was trying to identify people that really cared about Newark. At that time, CBPR was very a local kind of a thing, right? So over time, started with a really big board, about 30 people, understanding that over time we would be losing people, and that's okay. that's exactly what you want to happen, because the people that stay become the core people that understand the work, that are committed to doing the work, and that understand that this is not just about your job. This is about working on the community because you care, and building these relationships. So to do that, we were meeting every week, and we were getting training on theory, training on what is indigenous and scientific knowledge. How does that work? What are the types of knowledge? What do they bring to the table? What are the advantages and the disadvantages of these types of knowledge? I know that oftentimes you are working with boards that haven't gone through this process. It becomes difficult because they feel like they know what's right and you don't. And you feel like you're bringing the data and the data is saying what's right. And it's like, well, this is kind of, it's what the data says. But the community member is looking at the data and say, I don't believe your data. And, your data has problems too. So we have these conversations and we acknowledge, yes, data has challenges to it. It has bias to it, just like indigenous knowledge does. But there are different advantages and disadvantages of these different ways of knowing. And so we take the time to have these conversations to kind of come to consensus when we can. And in addition to taking the time to have these trainings and to learn about science, what are the methods that we're going to be using? We had trainings on MOST, we had trainings on critical consciousness theory, we had trainings on the community. Community members came and educated us on what was going on with them, grant writing and communication, investing time to talk about how do we communicate, building bylaws or memorandum of agreement where you have clear expectations about how the work takes place, and you have honest, difficult conversations about power differentials, right? Researchers usually are coming in with the power. So what does that mean? And how can we work together to try to share that power in ways that's going to be allowing the work to take place? And along with that, you do ongoing process evaluation of the entire process. So you're constantly looking at anonymous feedback from the members to identify where are you doing well, where are you not doing so well, and actually presenting that feedback to the board and brainstorming, coming up with ways of improving the relationship. You spend time getting to know each other. We would go out and hang out. We would go to restaurants and have a meal together. We got to meet their families. We would sometimes hold gatherings where we would come and get together. All of this really helped solidify the commitment and the relationships and the trust, because even though at different times we would disagree, we would still know that at the core we have a North Star, we have similar values, and we are there for the right reasons. So we could trust that we were going to work together and find solutions to the problems we were trying to find. And again, this is the long haul. So going to the preparation phase, you can see here, there are like 5 separate projects that we've done from 2009 to 2014. So we were writing grant applications. This is not a single project. We were writing grant applications. We were brainstorming. We were looking at the data that we were generating and having conversations about what does that data mean? How do we interpret that data? How does your knowledge of the community help us understand what this data is trying to say? Could there be methodological issues that could explain these things? Or is this really kind of what seemed to be happening? And over time, people would change their minds, and we were essentially building knowledge together. And that knowledge was helping inform the next project and inform the next project. And along with that, and the ongoing evaluations and the work in the relationship, it would strengthen the work we were doing together. We lost people along the way for different reasons. Some people were not the right people to be involved because they would create chaos and drama. They were bringing personal issues to the work, and that doesn't work. So the board would let them know. And there were times where great people had to move on because life happens and all of that. And sometimes they would come back, sometimes they wouldn't. And we would get new members that would always receive mentorship training again to kind of catch up with what we were doing. Until we finally got to 2016, where we had identified our population, our outcomes, how comfortable we were with measuring those outcomes. There was so much back and forth in figuring those things out. And what we would do is reminding again, We are researchers. We're doing work through research. So if we have a disagreement and we don't know how this is going to work, let's try it out. Let's collect the data and let that experience along with the data inform the decision-making process. And initially, it would be by majority vote. That is a tool that we have in the back end if we get in trouble and we need to move. But our goal is always to try to reach consensus. And one example that was a contentious issue, for example, with the board during the COVID studies, was the vaccine. What is going to be our position? Are we going to be coming to this community and telling people to take the vaccine? Or how are we going to do this? So we spent a huge amount of time, and there were all kinds of different ideas and strong personal opinions about whether to trust the vaccine or not. Through a lot of conversation, we came to a consensus that we would create a flyer, we would disseminate the information and let people make their own decision. So the flyer included information about the different kinds of vaccines. It included information about what was happening at the county level and why different groups were at higher risk than other groups. What is kind of like a little bit of the history of that vaccine. And some people, the community members were coming and disseminating this information to the community. Some of them
Lily,
wanted, yes.
you mentioned this shared decision making, and there are a couple questions, maybe more now in the chat about this. And I'm wondering, you mentioned that consensus building is the goal. Sometimes you used the majority vote. Can you expand on how that looked specifically when deciding on components for your optimization trial? Were you using a similar sort of consensus building process there?
Yes. So for the component selection of the trial, it was a very organic process, and it was a long process as well. As you can see, the project started in 2016 and we started in 2009, right? So it was a back and forth, and there were issues where we agreed and disagreed, and some of those components ended up falling out during the pilot testing, right? So for example, one component that we had considered was doing a family map that would be kind of an individual level session that we would do with participants that some people felt very strongly about, and others were like, well, that's really adding a lot to the dynamics. It's not going to be as feasible. So selecting the components, it's hard to explain like exactly how, because it was an organic process over time, right? We first did the needs assessment, and I can't quite separate also the selection of the components from the selection of the population and the selection of the outcomes, because we had so many stakeholders and different priorities that we were trying to respond to, that the way that we would come to those decisions were through many meetings where people expressed this is an issue. So yeah, with this particular component, it was the issue of sustainability and kind of keeping things short versus bringing some clinical things that some of the community members felt very strongly about, that it would be really important to do.
And
so
can I ask a quick follow-up? You mentioned that some of the components you identified didn't make it through the pilot process. Did you ever encounter a situation where some members of the board really wanted to keep a certain component despite what the pilot suggested, or sort of that tension you mentioned between data-based decision-making versus indigenous knowledge? Anything about that come up?
Sure. So on this initial component, the idea is some people really wanted, others did not. We decided through consensus that we were going to do a pilot of it and see how it goes. And we would include it in a pilot study with the other components and see how it went. And after that experience and seeing how much it took and all of that, the board agreed, okay, let's drop that one. But then we had kind of a flip situation. And so in this one, they kind of agreed with the data and they were comfortable with not including that in the optimization phase, right? But then we did the optimization phase. And in the optimization phase, when we look at the results, the quality of life wheel which was one of our components, dropped. We were not really sure about what happened with that. So the results, the relationship was in the opposite direction, not the expected direction, and it was not significant. So based on the data, it was very clear. You just drop it and that's just not going to make it. But the quality of life wheel is SMART goal development. If you look at the literature, there's very robust literature that supports that as an effective intervention, right? And there were a lot of members that felt very strongly that that would be still a good component, that we shouldn't completely drop it. We had lots of conversations about it, and ultimately in speaking with the group facilitators and speaking with the board members who were clients who participated in the intervention as research subjects, what we concluded was that perhaps the format that we used was not helpful for this particular population. It was too complex for them to be applying in their day-to-day lives. But again, we couldn't test that at this point because the trial had been over. With this understanding, the board agreed that we were going to stick with the data, and they felt comfortable with the assumption that perhaps it's the way that we deliver that component, and clearly it didn't work based on the data, also given the sustainability piece. So they agreed, with the understanding that perhaps in the future, we can go ahead and test that component again in a modified version and see what that happens. But we haven't done that, and we probably won't anytime soon.
All right, I'm taking advantage of this lull and
Go
raising
for
my
it.
hand. Hey, Lily, so I happen to have several folks that I'm working with on the webinar today who are interested in integrating the spirit of or aspects of CBPR and community engaged research, kind of a little bit more broadly defined, into the development of the conceptual model. And I wonder if you might share some of your thoughts about the best ways to do that.
Absolutely. Yes. So with the conceptual model, that was quite a learning curve. We actually had Carrie Kugler fly into Newark and do an entire day session with us on most, and half of that was essentially looking at the conceptual model. At that point, we were already a very mature board. We had been working together for 7 years. And we had all of that content, right, from all of our prior studies, the literature, the conversations we had under our belt. So the exercise that we did together, we basically built it together. We sat down around the table and we were like, okay, what are the components? What do we think that they are doing? We had spent also a lot of time in these initial projects developing measurements for what we thought critical consciousness was and how to operationalize that. So we also had the advantage of having spent a lot of time in doing that. So that conversation, once they understood what the conceptual model was, how to do a conceptual model within the most framework and what the purpose of the conceptual model was, we were able to put something together that we were pretty happy with.
That's okay, kind of summarizing, the advantage here is that you already had an existing relationship and board who already had identified a common goal or a common outcome. Could you just, like, in an unfair amount of time, Lily, think about how a early career investigator who is committed to community engaged research can do this with an outcome kind of in mind, but that also is true to the spirit of community engaged research?
If you're going to be true to the community engaged research, CBPR principles, you have to think about it the long haul. So break it up into small projects to make it more manageable. And start working the relationship. I think that that's the most important thing. And in putting these things together, I wouldn't start like a large project right away with a board. I would start always with a small pilot to test it out, to get the right people on the table, to do the training and all of this. Like I said before, you have to move in the speed of trust. You can't do this kind of work halfway. You can
I
still do
like,
community engaged research, right, with an advisory board, but you need to be transparent about that. Because if you're not, community members are not going to trust you. You're going to mess up the relationship with them, and it's not going to work out. So if you are serious about being into this, you need to understand the amount of work that it takes. You need to understand that there has to be long-term commitment there, and that you need to take the long view. Yeah.
I think that's a really nice way to end. And maybe just before Jillian closes us out, want to invite Carla, Andrea, Kenya, if there's any last things you wanna offer our group of folks who are predominantly academics who really are committed to community engaged research, things that you want to make sure we get to hear.
I think one of the big things is having people from the community. Me and Andrea are both from the community. We were raised down here. And even though we may not have gone through the same things that some of these individuals that we work with have, we know how East St. Louis is, as it could be a home, and we know the good things that comes out of this area. So I think it's really good to have, people that understand the ups and downs to their community.
Thank you for that.
And I think for the training and education are so important to make sure that the staff are truly trained and educated on the project itself. And Dr. Windsor and her team were so beneficial in providing us with all the tools and knowledge that we needed to make our project so successful.
Wonderful.
And then also to add to it, I would just like to say, outside of it being a job or a task or something that you may be completing, it's always to look at it as an experience, you know what I'm saying, and allow yourself to get to know the people or to try to see it from their perspective, because it really is different when someone is talking to their doctor and when they're talking to someone that they feel like is actually listening. And the fact that if you are listening to, help them, then people will really tell you how to help them.
What a great way to end.
Seriously, wonderful. Thank you so much. Kenya, Andrea, Carla, Lily, thank you so much for being here with us today and sharing all of your knowledge and experiences with us. This was really interesting. And Lily, sorry we missed you for part of it, but glad we we returned at the end.
I'm so sorry this happened. And by the way, if you have follow-up questions or anything, do reach out. I'm happy to talk, and even like individual specific teams, if you have specific questions about your project, I'm happy to help.
Thank you. Thank you so much for that.
Sure.